It's my pleasure today to introduce Sharon Hoover to talk about school mental health. I want to give a little background on our Beyond the Beds papers. Back in 2016, we became concerned that the narrative out there was we need more beds, we need more beds, we need more beds, and we didn't think that was the right narrative. So we moved to doing papers that had a theme of Beyond Beds. So in 2017, we did 10 papers through support from SAMHSA on the Beyond Beds theme. In 2018, we did Beyond the Beds, but with inspirational theme behind it. So similar to 0% suicide, to whatever the issue was. If it was on homelessness, it would be 100% of people would have homes. And then this year, because of us working with IIMHL, we wanted to have a convergence with the international community. So you're going to hear Deb Peinels tomorrow talking about Beyond Beds from an international perspective. So as one of the so what you're going to hear primarily over the next couple of days from us will be our 2019 papers. And the first paper we want to have presented is one that Sharon Hoover did on school mental health. Sharon goes all over the country to talk about school mental health. She's an expert in it. We're really fortunate to have her today as a speaker. So Sharon, do you want to go?
Thank you so much, Brian. We had the privilege of having Dr. Hepburn as our state mental health director for some time, and I have to say we miss him dearly, but we still have the privilege of interacting with him. So thank you so much for inviting me to join you. And my job is to speak to you about the role of schools in the mental health continuum of supports and services. It's where my passion is. Several years ago, I was working at the same time in a pediatric emergency department for some overnight shifts and in an outpatient center about half my time. And then the other half of my time was as a psychologist in city schools in Baltimore City. And that is where I fell in love with working in the schools, but also really where I decided that for myself, but really as a field, we would be doing a disservice to our young people and families if we didn't pay more attention to the work in schools. So I'm going to speak to you about school mental health. I come through the lens of our National Center for School Mental Health. I have the privilege of co-directing our center with Dr. Nancy Lever. We've actually been funded since 1995 out of our U.S. Department of Health and Human Services, and specifically out of the Maternal Child Health Bureau. You can find a little bit more about what we do at schoolmentalhealth.org if you want to check us out there. And I sit in the Department of Psychiatry at the University of Maryland School of Medicine, which is up in Baltimore. So with the roughly 25 minutes or so that I have with you, I'm going to touch on 5 topics related to mental health in schools. I'm going to start with school safety, and I'll tell you why in a moment. And then I'm going to move on to really walk through the continuum of supports and services, all the way from mental health promotion to early identification and intervention in schools, to access to care and treatment in the school setting. I'll talk about impact. So what do we know about the impact of providing mental health supports in schools? And then finally, I'll leave you with some resources. I may move quickly through the resources. Feel free to snap photographs, but I am also absolutely happy to share any and all of the slides. So ask me later, or if there's a platform to share them or share them through the app, I'm happy to do that as well. Okay, so we'll start with school safety. And you may be wondering why I'm starting with school safety as I talk about mental health in schools. But for those of us in the United States, we really are at a critical juncture, I would say, and part of a national dialogue around the intersection of mental health and school safety. And for those in the U.S., we've seen an uptick in federal attention and funding around school safety and school mental health in particular. And often we see this interest and increased investment after there have been incidents of mass violence in schools or in communities, but particularly as they relate to schools. And so I've been starting kind of discussions around school mental health with this topic in mind, because often I'm invited as part of states trying to figure out, for example, how do we integrate mental health into school safety? And it's a delicate discussion. And so I think, we have to kind of do this responsibly, but also argue that, there is a place for mental health in this discussion. When we see incidents of mass violence in schools, we often see responses that surprise us. And despite being well-intended, we see that they have the potential for some unintended negative consequences in the mental health respect for our young people. So this is an example of that. This is a letter that went out from a middle school principal in one of our states, and the state will go unnamed, but it's really not unfamiliar for us. We see efforts like this quite often, and I don't expect you to read the fine print. I'm going to pull out a few things from the letter. So it says, here we go, we are dedicated to educating and keeping our kids safe at school. As a result of the shootings throughout the United States, we are enhancing our procedure for intruders. My clicker has a bit of a lag, but we'll get there. The procedure will be the same as we've done in the past, with the addition of arming our students with a canned food item. We realize at first this may seem odd. And to some of you, yes, this may seem odd. Okay? The canned food item could stun the intruder, even knock him out until the police arrive. The canned food item will give the students a sense of empowerment to protect themselves and make them feel secure. We hope the canned food item will never be used or needed, but it is best to be prepared. And this is, frankly, my favorite part of the letter coming up here in a moment. At the end of the year, the cans will be donated to the food closet. Thank you for your support in helping us keep our children safe at school. And again, you can imagine you have this well-intended group of administrators and educators and families around the table who are what we would think of as, in an amygdala state, a reactive state to the trauma and the sense of insecurity and lack of safety that they might feel when an incident occurs either close to home or nationally or even internationally. And so we see efforts like this quite often, and this may look familiar to some of you. This was sent to me by a child psychiatry colleague from Stanford just recently saying, have we not come farther than this? So this was the magazine cover of The New Yorker back in September 1999, just about 5 months after the shooting at Columbine High School, where a number of students' lives were lost. And what his point was, and what the point of this article was, that oftentimes in our reaction to school safety being uncertain, we bring in measures to schools that really are not always guided by science and may inadvertently do some harm. This was an email that I got just a few weeks back. We get emails at our center all the time from concerned parents and students and educators and the behavioral health community about the large investment in what some call school hardening measures and the lack of investment of mental health in schools. So there's a lot of discussion happening. One of the most compelling discussions I saw on the topic of the intersection of school safety and mental health was at a congressional briefing last year following the shooting at Parkland High School, where Dr. Ron Astor spoke to two visions of mental health and safe schools. And he talked about schools that are welcoming and caring and supportive and that promote things like social emotional learning, mental health, school climate. And then he talked about restrictive and fortress schools as a vision with tools and ideas from law enforcement and military strategies and prison architecture. He then went on to speak to the wealth of research that we have on this first vision of mental health in schools in terms of targeting some of the very outcomes that we think about when we think about safe schools, right? So things like students' sense of security and well-being in the school environment, but also things like carrying weapons in schools and bullying in schools. When we implement this first vision, we often see a decrease in that. And when we think about the second vision, some of the data is not so clear. This is a report, if you haven't read it, it's quite compelling. It was commissioned by RAND. It's on the role of technology in improving K-12 school safety. They had panelists, they looked at the literature, and ultimately what they found was that the evidence about the technologies that we're putting in place in many of our schools is extremely rare or even non-existent for most of the technologies that we're putting in place. And then what was more interesting to me was the discussion about some of the unintended consequences of some of these technologies, and also certainly the cost. There is good news. We do have a number of districts and states who are considering how to better implement mental health as part of their school safety planning. And so I would just urge some of you who are at the table, or if you're not at the table, to go to the table when folks are coming together around thinking about mental health and school safety. This was a panel of the National Governors Association Education Policy Advisors. Some of you may recognize two people over from me as the Superintendent Rob Brunsey from Parkland, from Broward County Schools rather, where Parkland High School sits, and that's where one of the school shootings occurred in our nation. And he spoke to the emails he gets about on a weekly basis from community members urging him to put in these hardening measures, all the way from bulletproof whiteboards or bulletproof glass. One of the emails came in, he said someone suggested a dome technology that would drop over the school or maybe inflate over the school. I can't remember what it was. But his conclusion was that the primary thing we need to be doing is implementing social emotional learning competencies and efforts to keep our kids connected to school. And then the gentleman immediately to my left is the Director of Homeland Security for New Hampshire. And he was he was quite a character. He got up and said, I'm a former fire chief, my whole family are police and emergency medical technicians, and I was charged by my governor to come up with a school safety plan for my state. And I thought I knew exactly what would go into it until I got invited to a workshop on social emotional learning. And he admitted he thought he would snooze through the workshop on social emotional learning, and he said it completely transformed how he thought about school safety. And if you can look at the New Hampshire Department of Education website for their school safety plan, and it really does a nice job, in my view, of integrating mental health, social emotional learning as essential to mental health when we think about school safety. And the good news is we're seeing this same type of messaging come out. Some of you may have seen the final report of the Federal Commission on School Safety, and there are a number of references to the importance in school safety planning of mental health, of comprehensive school mental health systems, as we would call it. And so I would encourage you to look at this report. They talk about the importance of multi-tiered systems of support as a part of the effort towards school safety. So that was quite important from my perspective that came out in the federal report on school safety. And the final thing I'll say on school safety is that as you're invited to the table, or maybe not always invited, but as you sit at the table around this discussion, that we have to remember that, the delicate balance that we face in discussing school safety and mental health, and the risk of further stigmatizing mental illness in this discussion. So I'm often reluctant to even bring up mental health in the context of incidents of mass violence. And this is an example of why. This is a close colleague and friend, Dr. Jason Schiffman, who does a lot of work in the area of early identification and intervention around psychosis. You can play the video, and it's not so important what he's saying, but rather he was invited to speak on a media outlet around mental health and psychosis and how we can support people in the community in terms of mental illness. And what happened was that as he was speaking, so when he saw this later on, these were the images that were rolling behind him. And this has happened to many of us. And so it's just an encouragement to all of us as we think about how to communicate messages around mental health in schools, especially when asked to do so in the context of violence, that we're sure that whoever is conveying that message is not doing things to stigmatize mental illness. So that's the piece on school safety that I wanted to get across. All right. But ultimately, we absolutely believe that mental health should be at the table when we're talking about school safety. There are a number of states doing really, I think, innovative work in this area. Here are a few ideas in the policy domain. I'll just touch on them quickly. We see a lot of efforts around social emotional learning infusion into school safety planning. I mentioned New Hampshire. Big emphasis on school climate and connectedness. One of the best resources on this is the National Center for Safe and Supportive Learning Environments. They have an entirely free school climate assessment for all schools and districts in the nation, and just a really nice package on school climate. Many states are doing mental health training for school resource officers, which is, I think, a step beyond where we've been in the past. In terms of comprehensive threat assessment, lots of districts have this, but arguing to have mental health as a critical part of the team, we're seeing increasingly. In Maryland, we have something called the Safe to Learn Act, and one of the things that's embedded within that is having district mental health coordinators that really foster school community collaborations around mental health so that there's not kind of the disjointedness between schools and community that we often see. And then finally, this investment in our school-employed mental health professionals who are often the ones providing our frontline mental health supports to young people, and an investment in the community partnerships to provide support in schools. So second, promotion, prevention, early identification, and intervention in schools. One of the first pieces in this arena is really all of us reminding schools about what their mission is. So I'll ask all of you, if you could pick one quality or skill that all young people would possess by the time they graduate from high school, what would it be? Just think in silence for a moment. Okay, how many of you said chemistry? Yeah? Calculus. What did you come up with? Anybody? Compassion. Empathy. I think I heard social skills maybe. Any resilience, friendships, relationships, right? And universally, when we ask this question, at least 90% of the folks who respond identify something that falls on what we think of as our, well, what is labeled our social emotional learning competency wheel. Some of you may have seen this before. This is out of CASEL, the Collaborative for Academic and Social Emotional Learning. Many states and school systems have adopted this, but oftentimes, because of the pull towards academic outcomes, our schools struggle to think about this as part of their mission, but it has to be an inherent part of their mission, and we think about this as mental health promotion. What we are seeing in terms of some school districts is that they're trying to integrate this language into their mission. So this is an example of one change we saw recently. Blank public school system ensures academic success and social emotional well-being, they added, for each student in an inclusive and nurturing environment that closes opportunity gaps. And those words were added to the school mission. This is a district up in Maryland who added this, and we're seeing that increasingly. When we think about the continuum of supports that can be provided in schools, it's going to look quite different from school to school and district to district in the States. But one of our colleagues in Canada who we work closely with, and that's been part of this match process at IIMHL for some time, Kathy Short, introduced this model. And a lot of schools, the partnership between schools and communities does look like this, with your school-employed folks, often your school psychologists, social workers, educators, school nurses providing some of the universal or most of the universal and targeted interventions, and your community partners coming in and augmenting what might be happening at those levels with more intensive intervention supports. These are some of the strategies that we see in the universal mental health kind of arena for our schools. So things like promoting positive school climate, staff wellness, social emotional learning, crisis preparedness. And I'm just going to touch on a couple of these and share some resources with you. So I mentioned the National Center for Safe and Supportive Learning Environments. This is our go-to place for school climate improvement resources, so I encourage you to check it out. Wellness for school staff. I think this is an understudied and under-discussed topic, but we have seen more states, and especially at the district level, taking this on. And you may be wondering why, in the discussion of children's mental health, this would be an issue. This is an illustration of what it might feel like to be an educator in a classroom. Often our classrooms are 30 to 35 students, and it may be a bit hard for you to see, so I'll illustrate for you kind of what she's experiencing. So she's up in the corner here. You can see the educator in the corner, and the students are all engaged in different things. One is passing notes, one is snapping gum, one is cursing the teacher under her breath, one is making rude noises, and the teacher up in the corner is staring, ignoring disruptions, as she's been encouraged to do, but she's simultaneously plotting her career change, is what you may not be able to see. And we laugh, and I can't even imagine. I mean, I've worked in a number of schools, but being the educator in that classroom with young people who are experiencing significant disruptions around them, significant challenges in terms of their social determinants, is quite challenging. And it really is a serious issue in our society and in many of the other nations that I know are here today. I was just in New Zealand a few weeks back, and I happened to land in the midst of their teacher strike, and they had similar concerns as many of our educators in the US. And in urban districts, in Baltimore City where I work, for example, we have about 70% of teachers leaving after their first year or two in the profession. We know the literature is clear that teacher stress impacts students. So if we only care about children's mental health, we have to be paying attention to educator mental health as well. Some of our colleagues up in Canada have been doing, the cortisol studies of young people in classrooms and looking at the correlations with teacher burnout. So really fascinating work that's happening here. I mentioned social emotional learning. Again, just wanted to point you to this resource. This is one of the areas that we see a lot of promise and a lot of momentum in the States. So CASEL, the Collaborative for Academic and Social Emotional Learning. We had a match in Baltimore Monday and Tuesday of this week, and some of our colleagues from other nations are also doing excellent work in the area of social and emotional learning. So I'm hoping there'll be continued dialogue, not only this week, but to continue. Mental health literacy, we have a whole lot to learn in this arena in the States. But some of our states are adopting actually new laws to require educators to implement mental health literacy in their classroom. This gives you a sense of what mental health literacy is. It's understanding how to obtain and maintain good mental health, but also understanding disorders and their treatments, decreasing stigma, and increasing help-seeking efficacy among our young people and our educators. Again, our colleagues in Canada have shared tremendous resources in this area. We saw new laws passed in New York and Virginia, with one on the way in New Jersey, around this area. So we're hoping to see some momentum here. Crisis preparedness, many of our schools, especially after incidents of mass violence, are introducing this in a way that really equips the broad school community to be thinking about the mental health response to crises. And then finally, early identification and intervention. One of the things that seemed to be universal across the nations that we met with earlier in the week was the idea that some of our frontline providers are our educators, or in many cases, in Sweden, for example, they talked about school nurses as one of our most important frontline providers for mental health of our young people. And what we know is that we have to be addressing mental illness or early identification and intervention in the school setting, in part just because of when it occurs, right? So we know, as illustrated here, that about half of all mental illness, the onset is by the mid-teens roughly, with about 3/4 in the mid-20s. And we know that later onset are often secondary conditions with severe disorders, often preceded by less severe disorders that may go untreated. So we have to be attending to early identification and intervention in the school setting. Some policy areas that we are excited about, that we see efforts in, again, social emotional learning has become part of the state standards for some states. We've seen a triple increase in this in the past couple of years. Investments in health and mental health promotion in schools, again, social emotional learning, crisis preparedness. We see many districts and even states tackling the issue of universal mental health screening in schools. It's a complex issue. We've put out a fair amount of guidance on the topic, so you can check that out at our site. And now we'll move to access to care, and specifically mental health treatment in schools. So oftentimes people may get that schools are the place to do mental health promotion, but they don't often think about schools as kind of the venue for care or for intervention. So this is a 16-year-old student from Omaha, Nebraska, who was coming to school. It was right before the fall, and he was going to come, but was coming to try out for soccer. And it was one of his main motivations for coming to school and doing well in school. He loved soccer, loved the team, and had played on it for a couple of years, but was told that if he didn't have his sports physical, he wasn't going to be able to try out. He didn't have a primary care provider. He called, and he found out about and called the school-based health center, and was told that he could come in tomorrow for his sports physical. And he went, and he was able to then successfully participate in the tryout. He made the team. And this was a health example, right? We have lots of school-based health centers around our country. But our schools are really also an essential access point for mental health care. And there have been some interesting and I think well-done studies that have looked not only at initial access and how schools are essential to that, but also follow-through. So our typical follow-through rates in mental health, in community mental health treatment centers are horrible. Having, again, worked in many community mental health settings, the no-show rate, and this was true to my experience, the no-show rate is about 50%, sometimes greater in highly stressed communities. In schools, we don't see those types of no-show rates, unless you have a student who's struggling with chronic absenteeism. Here's an example, a study by Jay Cox that's cited here. They found that youth, this was actually a trauma intervention that was implemented in schools post-Hurricanes Katrina and Rita. They found young people in a randomized setting were 6 times more likely to follow through and complete mental health treatment when offered in schools as compared to community mental health settings. And we've seen this multiple times now in a variety of studies. There are a number of mental health treatments that have been designed for schools and some that have been designed for community settings that are being implemented in schools. And if this is not happening in your community, I'd encourage you to be engaging with the education sector to think about how could we do a better job of getting mental health into the community. We were speaking with one of our colleagues in the match who was saying that they've successfully in one of their districts moved 32 of the 34 mental health providers in the community full-time into the schools. Cognitive behavioral intervention for trauma in schools is one example of an intervention that was designed for use in schools. It was developed in Los Angeles Unified School District. There's too much on this screen to see, but the point that I want to make with this is in a statewide implementation of cognitive behavioral intervention for trauma in schools, which is an evidence-based trauma treatment, they had a 90.3% completion rate for the hundreds of students who were actually seen with this treatment, and it's a 10-session treatment in schools. That's compared to a dismal 15% or so completion rate for most of our evidence-based treatments in the community. And schools are doing really innovative things, and because people will say, well, what about the summer, and what about, our lack of child psychiatrists, and those are all legitimate concerns, but schools are adopting innovations in this area. We're certainly adopting telehealth. We've been doing telemental health in schools in Maryland for 15 years or so. They used to be really clunky machines that I'd have to roll into my office in the school, but now we're using our phones and our tablets and so forth. We also are seeing increasingly school-based health centers, for example, being open all summer or finding ways of partnering with community mental health to offer services in the summer as well. Exciting policy moves in this area, state infrastructure grants, like for example in Minnesota, where the state legislature has voted to fund mental health in many of their districts, and so they offer funding support essentially to seed or to supplement some of the fee-for-service revenue that they're able to tap into for mental health services. Some of you may have seen the jointly issued statement from the Center for Medicare and Medicaid Services and the Substance Abuse Mental Health Services Administration that was released in July that spoke directly to how you can better leverage funding to support school-based mental health and substance use services. It's an excellent document, in my view, in terms of kind of moving the needle a bit on how we can think about schools as an essential site of service. Impact. Why mental health in schools? To me, it's evident just on the access point alone, but there's also really compelling evidence that when we implement mental health interventions in schools, they have a positive impact. There's lots of reasons for this, so access certainly, but there's also data to show that children lose less time from school, families less time from work. I'm a mom to 3 kids, and I know having to take them out to get them to their pediatrician's appointment, we typically lose about a half a day each, whereas when those services are offered in the school setting, we're much less likely to lose that amount of time, and the data is consistent on that for mental health services as well. Many families and students report that schools are a less threatening environment. That's not across the board. Not every family in school wants to receive their mental health services in schools, but many do. And the list goes on. When we're in schools, we have to demonstrate an impact on academic outcomes if we're able to. We did a meta-analysis that looked at just that question, and we found that in the published studies that we had looking at the psychosocial and academic impacts, that yes, in fact, when we implement mental health interventions in schools, we see a positive impact on academic indicators like grades and attendance, and even state test scores, which our administrators get excited by. So we also have seen a number of studies documenting the reductions in chronic absenteeism when you put school-based health centers and school mental health services in the school building. Here's our student from Omaha who was on the front page kind of attesting to the role of school-based health centers in our student success. Couple of policy pieces here, especially in terms of documenting impact. We've seen some states be really creative in terms of how they require health and academic outcome data from community partners who are coming in. We don't want a model where community mental health just comes in and doesn't really integrate into the school setting. We want there to be accountability in terms of the outcomes that they have to offer to the schools. And then finally, in my minute or so left, I'm just going to share some resources with you. The first set of resources comes out of our National Quality Initiative. We were charged a few years back with developing a set of national performance standards on school mental health quality. This comes on the foundation of years of research into what are the quality indicators for school mental health. These have all been implemented into an online free system for all schools and school districts across the nation. And as of last week, any individual, including all individuals internationally, can go into the SHAPE system and assess how they're doing in terms of their degree of implementation of the school mental health best practice indicators. So you can take out your device if you want, you can go onto the SHAPE system, and what it allows schools and districts to do is to assess how they're doing. They get these beautifully generated reports that say, here's how you're doing, but also here's how you can improve. And it kind of guides a process of strategic quality improvement. Schools and districts get different stars, which we all appreciate, getting our gold stars for doing good work, and we have thousands of districts that have gone into this point and engaged in the system. The Mental Health Technology Transfer Center, and I think I saw Heather Gotham in the room. There she is waving. If anyone has a question about the MHTTC, here is your point person. We've been really privileged to partner with Heather and her entire team as part of this network. SAMHSA had the vision of doing a regional network of centers across the country to support technology transfer for mental health, and they supplemented the work to focus specifically on school mental health. One of the things that we did in partnership was to develop a national school mental health curriculum, again, available freely online. You can go to the Mental Health Technology Transfer Network site. I think it's mhttcnetwork.org. Got it? Okay. And you can download the curriculum, which is designed for school district leaders to implement these quality indicators. Finally, we have a national conference that's in its 24th year, so if this is really an area of passion for you, you can visit us in Austin, Texas in November, and we'll be back in Baltimore for our 25th conference in the fall. And we do have a guidance document for states and districts actually being released next week, which we did in partnership with some of our federal partners at the U.S. Department of Education and SAMHSA and HRSA, that goes into guidance on comprehensive school mental health systems. So you can check it out. It'll be up on our website for download next week. And here's how you can reach us if you'd like to. And thank you for the time.